Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Another behavior, Christian, if you don't mind, and I've been a little tentative about this one all day, but let's get into it. You mentioned nocturnal enuresis, commonly known as bedwetting, during the earlier Brother Be Well podcast. That was called What is Trauma? So check that out if you're interested in it. Some parents who are managing it in their children, as well as other young people themselves, and even adults who are struggling with that behavior, may be surprised to learn about the connection between bedwetting and stress and anxiety. I'm a little nervous about that. I was that kid. And I remember not having any of the connection between what was going on at night and what was going on in my house, and even going to a doctor, and I was checked out physically. And I remember the moment when the doctor said, "Is there anything going on in Michael's home?" And he asked one of my parents that, and internally I was going, "Oh God, please start talking about this." But we weren't a family that was ready to address it. And it was years before I figured out there was a connection there. Can you talk about the connection between nocturnal enuresis and stress and anxiety and what it can do to a kid? And even if it's not taken care of, it can carry over into adulthood.
Absolutely, and Michael, you're not the only one. It happened with me as well. Through the age of 13 years old, and this is during a time where my parents didn't have that education and information on what was going on, and it was related to anxiety, being anxious. So and I'm just thinking back what happened with me, and how uncomfortable and shameful it made me feel because I couldn't spend the night right in someone's house at 13 years old because I was embarrassed. So you're not the only one in that boat. And now that I understand, it can really be caused by that psychological response to trauma. And children have that difficulty, like sleeping and that sleeping and experiencing nightmares. With the anxiety, like I said, and the guilt and shame. So this causes really it causes really them to develop these defense mechanisms. It's a subconscious defense mechanism, really, what it is, which is like regression. So they're regressing back to an early developmental childhood stage, which is bedwetting. So this is all happening subconsciously. It's a matter of subconscious control, if you may. So there's also a relationship between sexual trauma too, which is related to the sex organs and the type of regression in that area. So that's why a lot of social workers, one of their areas, what they do when they're assessing, when they go into a home, they ask that question, how often does a child, wet the bed, and they have to kind of look, and that alone does not merit sexual abuse or neglect, but that can be one of the components. And as a parent, you want to be patient with your child during this time, and continue to monitor the behavior as it may go away, and not shame them for bedwetting, regardless of how old they are. So there's that supportive element too that you have to have as a caregiver.
I really appreciate you affirming not just my experience, Christian. That's not what this is about, but there are a lot of people that are watching this video that I have a feeling saw a bit of themselves or their son or daughter in that, and it's so great of you to make the connection between the behavior and the past experience, and again the not shaming. I too remember, not being able to do sleepovers, and then that just the anxiety about that. But then it was like a slippery slope. It's a chicken and egg kind of thing. You're already a little anxious, and then the anxiety is heightened by what you think might happen. So thanks for walking us through that. Really do appreciate it. Really do appreciate it. I want to ask this question about unresolved trauma. And I've learned never to assume that I've got the right answer with you, Kristen. You've taught me so much here on this platform. I think I know the answer to this one, though. Can unresolved trauma result in PTSD?
That's really an interesting question because it really determines, it really is determined by what the unresolved trauma is. So, for I give you an example, if you had an experience that was traumatic related to violence or abuse, things of that sort, and it was unresolved, and maybe down the road, you know, you actually realize that you have PTSD, then yes. So you're looking at a situation where that unresolved trauma was initially PTSD. It was just never either recognized or diagnosed, things of that sort. Now we're talking about unresolved trauma in general, such as say for example, I had some type of issue, with speaking in public or at school in class. Now you're talking about an ACEs score that will be high, but it may not result in having PTSD, which meets all the criteria for PTSD. So the short answer, it really depends on what that trauma is, how prevalent it's been, and if it meets that criteria in the DSM for PTSD.
All right, I thank you for that. And just for the uninitiated, DSM, can you just tell us what that is?
Yes, that's a diagnostic statistical manual 5, which is basically used for clinicians use to diagnose patients officially, and they have to meet all the criteria within that book. So they just can't really make up a diagnosis. You have to meet those criteria in the book.
Really appreciate that, Christian. Let's talk about what I think, anyway, is the most pernicious of the behaviors that can come out of unresolved trauma: suicidal thoughts and actions. It isn't uncommon, I'm told, among people who suffer from PTSD. Can you tell us about suicidal ideation as a byproduct of unresolved trauma?
Oh, most definitely, and I think that's it's probably one of the most serious symptoms of PTSD. You have to look at what we've talked about today, right? We talked about denial, right? We talked about delay, right, and understanding the condition, and these are all things that can be a recipe for someone starting to feel that can start to feel hopeless, right? They start to feel like there's no way out, and there's really not a symptom that can be cured or treated, and it keeps happening. So a lot of times that hopelessness and that depression sets in, where an individual starts looking for a way out. So unresolved trauma, can really go towards that way where someone starts having suicidal ideations. And there's a difference between suicidal thoughts and suicidal ideations. So when you start having those ideations where you're having ideas of doing some harm to yourself, then that's where getting involved with a professional, a mental health professional, is very important. And also having that connection with someone who knows what's going on with you is very important, because they do go hand in hand.
We're going to be exploring suicidal ideation on the Brother Be Well platform. We've got a great personal story, a young man that I met years ago, and he's got a heck of a personal story. So we'll be highlighting him on this platform, brotherbewell.com. I want to encourage you, before we pivot here, if you are thinking of suicide, if it's coming to mind, if you're starting to develop a plan, we've got it right there on the screen, the National Suicide Prevention Lifeline, rather, 1-800-273-8255, 1-800-273-8255. Please call, please text. There's help for you on the other side. So please do that for us. As we get ready to wrap this conversation up, Christian, again, my question to you: if you've seen any of these videos, you know where I'm going with this, right? What are your tips for someone who thinks they may be dealing with unresolved trauma? Maybe based on this conversation that you stumbled across, or maybe you're having thoughts about it is what led you to click a couple times and check this video out. What would you have to say in terms of tips, Christian, for either that individual or for the caregiver or loved one who is dealing, managing, helping someone that they believe to be struggling?
Well, first, Michael, I think if, for individuals who may be a bit younger, who may not be adults and have the, liberty of driving or, going places, things of that sort, it's really important that you talk to your caregiver. It's really important that you, reach out to them and find out what, first of all, what's going on and kind of really talk that out. And then also see what type of resources are out there if you can receive some type of help in that age range, of being in school age and not really having those resources to independently go out. As what in terms of mental health, at the age of 12, you can consent for yourself. So by law, by the age of 12, at the age of 12, you can consent for treatment. And there's more information on that as well. But if you're interested, also looking at the 1-800 numbers that were provided. Also look at the resources in terms of reaching out to that professional as well, reaching out for adults, reaching out to your health professional to see, what type of services are out there in terms of group therapy, group services, individual therapy as well, to really be assessed, because being assessed is the first step. You really want to find out what's going on and see where you fit in terms of your severity of treatment. And also, when you're having those severe issues in terms of suicidal ideation, making sure to call for immediate emergency help. Usually using that 1-800 number, but in a crisis situation, you want to call 911 at all means. So those are some tips that I would really encourage everyone to really look at when they're dealing with unresolved trauma. And also some things you can do for yourself if you're not ready for those type of things is, internally, is really doing some self work, in terms of, journaling down your thoughts and seeing, if you could really navigate what's going on in terms of your feelings and emotions. So by the time you meet with a professional, you're able to really share a little bit on the work you've done, and it gives them more of a guide to, develop your treatment goals and your treatment plan, because you've kind of done some of that work on your own already. So those are some tips I would recommend for any of my clients.
That's a powerful final tip. You said so many powerful things today, Christian. Looking back on my own journey, I did not do some of that pre-work ahead of time. So I had to spend time in a therapist's office, doing something I could have done on my own just because I didn't know that that would be helpful to do that. So that's a great, great tip. Just write your thoughts down, do some journaling. Very, very powerful. Christian Jacobs, marriage and family therapist, Brother Be Well clinical advisor, and I'm most proud to say, friend of mine. Thank you, Christian, for joining us for this conversation. I can't tell you how much I appreciate it, and I also can't tell you how quickly I'll be calling you again for another conversation.
It was a pleasure, Michael. Thanks for having me.
Really great to have you. We'll see you soon. And I'd also like to thank our sponsor for this trauma and healing series here at Brother Be Well, Blue Shield of California, and specifically their Blue Sky initiative. That initiative boosts access to mental health support. Learn all about that fantastic program at bluesky.blueshieldca.com. That's bluesky.blueshieldca.com. Another website that I want to tell you about that I want you to remember, brotherbewell.com. If you like this video, you want to check out the rest of the trauma and healing series, check it all out at brotherbewell.com. Videos on a variety of other topics, all designed to support the mental health of boys and men of color, 13 and up, African American, Latinx, Asian and Pacific Islander, and Native or Indigenous. It's all right there, brotherbewell.com. We're a membership supported service, so if you can join, that's fantastic. If you just like to check out our blog, just give us your email address, and couple few times a week, you'll get notifications when conversations like this go live. Lots of resources at that website. Check it all out, brotherbewell.com. My name again, Michael P. Coleman, content director for Brother Be Well, and I want to encourage you to please do a couple things for me till I get to see you next time, and I'm looking forward to that already. Take great care of yourself, and we're trying to help you do that. Once you get it down and you think you can, reach out to somebody else and take good care of them too. Till next time, bye-bye.